From WNYT Albany, News Channel 13 live at noon begins right now.
Welcome back. If you have a runny nose, a cough, congestion, is it the cold or allergies? Here with some advice on how to tell the difference, Dr. Diane Tennenbaum from St. Peter's Hospital. Always nice to have you here.
Thank you very much. Lovely to be here.
So is it easy, would you say, to spot the difference between the two?
I don't think it's easy, even as a physician, number one. And number two, I think that this year in particular is pretty difficult for a couple of different reasons. Number one, everywhere you look, if you look on any of the websites online with a weather website or anywhere, basically, the discussion about tree pollens being so high this time of year,
right,
it's really
bad season.
It is a bad season. Although, honestly, I halfway wonder if we say that every year. Sometimes it feels that way based on what month you're in. But in addition, because there was sort of a later flu season, there are other viruses that are sort of circulating right now, it can be particularly difficult. And I find this year, both for parents and frankly for pediatricians as well, to be a little challenging because the two are not necessarily mutually exclusive.
Well, would you say there is a difference in symptoms, or is there one particular difference that we should pay attention to?
The symptoms can be very similar. Both are associated with some nasal congestion, also with some cough, also with some sore throat. You generally won't have a fever or the body aches with allergies as you would with a cold, and certainly with other viral infections that's even more true. So those things can be true, but as I say, we're seeing lots of patients at our practice at St. Peter's that may have sort of baseline allergies, if you will, and then are getting a viral process on top of it, so it can be tough.
So you have both, which is very fun.
Yes.
I was looking at this chart that you sent over, and one thing that stuck out is the duration. So colds, generally, we're talking a week to 2 weeks at most. Allergies can be very different.
Absolutely. And in fact, we usually tell patients with any sort of viral process, after about 7 days, if you don't think symptoms are at least beginning to improve, that's a good time to call us back, or if you haven't already, talked to your doctor at that point to do that. And certainly allergy season, depending on who you are and what your history is, can be a lot longer.
Well, as we talked about, everyone's saying this is going to be a bad allergy season. Already is for a lot of people. I know I've been suffering. Any recommendations you have to try and ease the pressure at all?
Well, certainly if you know that this is the time of year where your allergies are always a little bit worse, we would recommend that you decrease your exposure to those tree pollens. So as much as it's pretty nice right now to have your windows open and everything else, try to close those, especially in the evening. We also recommend that children tend to take a shower at night after they've been outside playing.
Okay.
Because we always want kids outside playing, wearing sunscreen, always, always. Try to throw in sunscreen and bike helmets, everything. Right. You guys know me really well. So yeah, we recommend that they take a shower to sort of get all of those pollens off of their heads and the rest of their bodies and everything else, and that's a good time to sort of decrease your exposure by taking a shower afterwards.
Allergy meds, are you in favor or against?
You know, the answer to a lot of these sorts of questions is it depends. If you know that your child has an allergy to specific tree pollens, and you know that some of the over-the-counter antihistamines have worked in the past, then that's a fine recommendation.
Okay.
If, on the other hand, you have a child under 2, that may be something that you would want to discuss with your pediatrician, because airborne allergies tend to be less common in children under the age of 2.
All right, Dr. Diane Tennenbaum, thanks so much for being here with us.
Thank you.